Saurabh, allow me to share, please.
Yes. Good morning, everyone, and good evening and good afternoon for a lot of other places in the country. Today, we have 70th session of COVID weekly meeting for International Weekly Forum in association with CMAAO. Thank you so much for helping us out to reach to a remarkable number. We are heading towards 100. And with your support, we would like not for the support of carrying forward the meeting, but changing the topics from pandemic to a regular topic. So today we have a country update from most of the countries, but the special focus will be on Malaysia, since Malaysia has been considering the amount of population there and the number of cases going on, is something which we would like Mr. Ravi to talk about it. And so we will have the country updates, and this is one session which we have every month, where we allow all the countries to provide their regular updates. So over to Mr. Chong, who is also the chair with me in this meeting. Mr. Chong.
Thank you. Thank you very much. Thank you all for joining us to our 78th meeting. As always, a pleasure to see everybody here. And just quickly, I have actually an update from Singapore, but let's go to Malaysia first and let Ravi tell us what's happening over there. Ravi, over to you.
So before Ravi can take over, I wanted to show one website which I think I was going through right now, and it shows all the worldwide situation, which I was very surprised. If you show somebody graphically what's going on, they realize how bad the situation was. So if you see this website, I don't know if you can see my screen.
Yes.
So this is the website which is by Johns Hopkins University. It's a COVID dashboard. If you see the number of cases, if you see the whole country has been in the red. The bigger red shows the bigger cases, the smaller red shows the smaller cases, then it shows the administered vaccines, the total deaths. So, it also shows the daily death. If you see the graphs is still rising, it's not that the third wave is not coming on. So I think if you compare with the worldwide situation, it is still pretty bad. It's not something which has been a piece, where we can just go on and go to a regular life. So I think I would still urge people to still go with the COVID appropriate behavior. And with this note, I would like to invite Ravi for the Malaysian. He's from the Malaysian Medical Association, and he's also the past president for CMAAO. He would like to present the data for Malaysia, and then we will take it forward.
Thank you very much, Saurabh. Good morning, good afternoon, good evening to everybody. Thank you very much, Dr. Chong, my neighbor in Singapore. Well, Malaysia has a population of approximately 32.5 million people. And till today, vaccination is up to 23.1 million have been vaccinated, out of which 7.9 million have got 2 doses, and the balance 15 million have got only a single dose. The cases are increasing tremendously. As of yesterday, we hit 20,889 cases. If you remember last week, I was talking about 17,000 cases. And it is just rising steadily, actually it's rising. And the number of deaths are also increasing. As of today, the total number of cases in Malaysia is 1.224 million. And total number of deaths, 10,177 deaths. This is as of yesterday. The government of Malaysia has now categorized COVID into 5 categories. They have category 1, category 2, category 3, 4, and 5. Category 1 is asymptomatic, which means no symptoms. Category 2, mild symptoms. Category 3, they have pneumonia. Category 4, pneumonia, and they require oxygen. And category 5, they have got pneumonia and need ventilator support. The fortunate thing is, as of yesterday, there was only about 78 cases under category 4. Though we have 20,000 cases, 78 cases were only under category 4 and 48 cases under category 5. The rest fall under category 1 and 2 and 3. But this can increase from category 1 to 2 to 3, and then it can go on to 4 and 5. And so what's happening now in Malaysia is the government has been, they have imposed a total lockdown since June. For the whole of June, July, and now into August, we are still in a total lockdown. All schools are closed. Many businesses are closed. Restaurants are only takeaway. Only essential services are allowed. And the government has now come up that only 40% are allowed to work in offices, which means the rest 60% have to work from home. Then the laws are there for SOP. For example, now using of face mask, social distancing, and if you're caught without a face mask, it's a penalty straight away of about 1,500 ringgit. Prayer worship places like mosques, temples, churches are all closed. Everything is closed. Many of the churches are now doing it online. And so, as all of you know, worship houses are all closed and restaurants are closed. Yet, the cases are increasing. Why? Now, the blame, of course, goes to the Delta variant. And because it's supposed to be very contagious, even our parliamentarians, 6 of them have been affected by COVID during the parliament sitting last week. So we are in a dire situation now, So worrying, we do not know what's the future. We do not know when the lockdown is going to be removed. Of course, the government had come out with stage 1, stage 2 for lockdowns. We were supposed to be in stage 2, but looking at the number of cases, we are not able to go to stage 2. And restaurants and all will probably be open only when we go to stage 3. And we are only in stage 1 now. So we hope the only answer looks like is vaccination. I think that's about it I have to say from Malaysia. If anybody got questions, please ask me.
Any questions from the floor?
This is the graph I wanted to show for Malaysia, which I was looking for.
Just I had actually I was talking with Dr. Ravi.
Yeah.
You have imposed that is lockdown and others, and also Malaysia is very strict in executing its law. But why so much cases I have seen here? Actually, it's really too high in Malaysia. I have seen this is per million. You have a lot of actually cases actually per million in
1.2, yes.
Yes, it's near about 37,313 per million cases. So it's too high. Where in Bangladesh it's only 8,020 per million cases. Of course, you tests are far high actually in comparison to Bangladesh cases.
That's right. When you compare with other countries, Dr. Jamal, you have to look at the population ratio. We are only 32 million, and we are now, we have already got about 1.2 million cases and approximately 10,000 deaths, which is actually considered very high. I mean, maybe when you compare to Singapore. Singapore has got 5 million population, but if you take the ratio wise, I think we are really very high. Why? We also do not understand why. I think the government hospitals here are bursting now because you must see patients, they're lying on the floor, sitting on the chairs. It's become that bad actually, now. So they're coming up with a new system. In fact, this afternoon, they're going to announce the latest task force has been formed to find how they're going to handle these COVID cases because there are no places in hospitals. If you call an ambulance to take you to the hospital, they'll say, sorry, there's no ambulance available. You have to find your own way to the hospital. And when you go to the hospital, you are going to be sitting in the corridors on the chairs. They have converted car parks in hospitals into COVID beds and all that. that bad a situation we are
This
facing.
is pretty
here.
much situation what India had about a month back.
Yes.
And what about the oxygen? What about the oxygen?
It is only Delta variant there? Delta
variant. No, they also talk about the Alpha variant, but the main one is the Delta variant. The hospitals, of course, are really in a bad situation now. So if you call up even a private hospital and say you are in stage 1 or stage 2 and you're worried and you want to get admitted, they say, sorry, no beds. That is the situation here now.
So Ravi, I have a question. Since I have come through this phase and closely monitored, similar situation, and we were also treating COVID patients online on a virtual platform.
Yes.
So how, apart from the hospital aid, like how is Malaysia treating as a home treatment?
You see, the setback in this country is the government has not given the full freedom for the general practitioners to treat COVID patients. In fact, we have been fighting to allow, we have got 7,000 over general practitioners in Malaysia to allow us to at least treat like stage 1, stage 2, and those who are quarantined. But so far, they have not given us the go-ahead. So everything has to be done by the government. The health
I think
department.
this is where India was little lenient on that front, where in fact Dr. K.K. Agarwal, where he started an online OPD system, and we were supplying the oxygen concentrator, and this is something which you should follow. Like, Malaysia, this is a practical example of what India has followed.
Yes.
And the oxygen concentrator, under the guidance of the medical supervision, was being given to the patients who were on a very early stage of COVID, and if the oxygen was seen drop, and if there were no beds, then you need an oxygen. You can't lose a patient.
Yes,
and certain pre-medication and stuff was actually saving a lot of patients. Obviously, we are not asking people to do over-medication, but a primary, healthcare worker can help the patients to at least, remove the situation of getting worse.
Yeah, actually, what is happening here is many of these organizations, like Rotary and all this, they are providing oxygen concentrators, But as a clinic, we are not allowed. They do not allow. We have in fact been told if any patients come with a fever, sore throat, we are supposed to refer them back to the hospital. That means as a general practitioner, we are not allowed to treat this kind of cases in our own clinics.
And also, is there a differentiation between a COVID hospital and a non-COVID hospital? And do you need a certificate for getting it admitted?
Some hospitals have been classified as COVID hospitals, but they are mainly in Kuala Lumpur and all. But many other places where the normal hospitals have been converted to COVID hospital. So what is happening is cold cases, other cold cases are not being allowed to come to the hospital. Follow-up is being done and say, just collect your medicine and go back and come back another time. They only handle emergencies for other cases. Otherwise, most of the hospitals have been converted to COVID hospitals. So the normal patients with even like a fracture and all are having a big problem in hospitals now, because we are not able to cope actually.
But Dr. Ravi, number of deaths is high actually. Why do you implicate this actually? Number of deaths, it's more than 310 per million. I can say.
Yeah, correct.
Do you think that it is also due to variant, the Delta variant? But
no,
actually don't see any difference.
Well, according to what the Ministry of Health is talking about, is they are talking about Delta variant, because initially it was all those 60 and above with comorbidities. Of late now, we are seeing cases, the younger, 30 years old, 40 years old, without comorbidities are also affected and dying. We have one doctor, a pulmonologist, also died, you see, because of COVID. So many cases are happening now. Young doctors, 37 years old, 40 years old, it's happening.
Ravi, what about the reinfection and breakthrough?
Well, the reinfection part has not been a problem yet so far. We don't have that problem now. These are all first-time infections, So that's why now the government is emphasizing on vaccination. They say the only way now is to vaccinate, and that is why they're going all out. Now we are having in even the documented migrant workers and the undocumented migrant workers are now trying to be vaccinated, because you must understand, we have about 3 million documented migrant workers, but we have another 2 or 3 million of undocumented migrant workers. So now the undocumented migrant workers are worried because the minute they come in, because you have to give your name, your passport number, your address, their worry is the immigration will come after them and arrest them next day, you see. So that is why to get the undocumented workers is a challenge here now, because of the fear of being arrested by the police and the immigration.
Yeah. I'm sorry to hear this, Ravi. I mean, it's a political crisis as well. That I think that's.
Oh yeah, that's another mess we are having in this country. The other issue that's in this country is as a political mess now. The ruling government, and then there is another group that wants to take over the government. They're asking the prime minister to step down. I mean, at a time like this, I think the priority should be the people, should be COVID, not the political positions and all that. They're talking about majority in parliament. I mean, I think Dr. Chong knows quite a lot about our political scenario here. This is why the people here are very upset. They say right now, this is not the time to worry who is the prime minister. This is the time to take care and help the people come out, because not only are we dying because of COVID, many people have lost their jobs. They got no food. You know, a lot of private organizations have come up. We have even got what you call a white flag. If you got no food, you can just put up a white flag in front of your house, and they will supply food to you. Then they know you are now in a very bad situation. It has come to that situation now. Loss of jobs is just beyond control now, actually. And then, you know, every job, you see, like, for example, contractors, housing contractors, you know, other jobs, they're all not allowed to operate now because of the COVID. So what about their workers? They are workers on daily wages. How are they going to survive? So it's bad, actually very bad.
Sorry to hear this, Ravi.
Thank you, Dr. Chow.
Any more questions from the floor? If not, I will carry on and just present what's happening in Singapore, because we're neighbors. So, I mean, since we're neighbors, I must just present what's happening in Singapore. Is it okay? Anyone? All right, let me just share screen. Can you all see my screen?
Yes, we can.
Okay,
yes.
This is the latest release from our ministry. It's of 5th of August. This is the latest release. So this is the chart of all the cases that we had in the last month or so. And you can see the total number of cases are coming down. But these are the highest number of community cases we've ever had so far. The legend is very simple. The green ones are linked and quarantined already. These were picked up by surveillance, and these are the unlinked cases. So we are always very worried about this group of cases. And our national vaccination program is now hitting 78% of the population with 1 dose. 65% of the population has 2 doses. So in the next 2 to 3 weeks, we will hit across 80%, which is where we want to be, people with 2 doses. So this is because you see that we have really accelerated our vaccine program. And we broke up the subgroups of the vaccinated, and the one we are very, very concerned with are the elderly. This is the black line that you can see, those who are 70 years old and above, and they are only hovering at 81%. So there's another 100,000 more of them who have not been vaccinated. And it's not mandatory, but we are pushing very, very hard to get these people vaccinated, because the figures later I'll show you is showing that this group is going to put us at risk. But the rest of the groups you can see, the younger groups and so on, the younger groups have all, they're all, you know, above, hitting close to 90%. So these are the ones who have completed 2 shots of the vaccine. And this is the total number of vaccine doses that we've administered. Now, there are 577 cases in hospital now, 40 need oxygen, 8 of them are in ICU. And among the 48, there are serious, 7 are fully vaccinated. So it speaks for itself. 41 were not vaccinated or partially vaccinated. 5 require oxygen, 2 require ICU. A lot of them have underlying medical conditions. And 36 seniors above 60 years old have fallen very ill. Again, high risk group. And of course, we had 1 death the day before. And our death now has, we've remained stagnant at 37 deaths so far. But in the last few weeks, we have moved up to 40 deaths. So it's still small numbers, but still unfortunate. Every death is an unfortunate event. And you can see our graph here, those who are in intensive care, right? Intensive care, those who require oxygen, they're all broken down by age. And you can see the biggest ages are those above 60, the gray graphs. This is a very interesting figure because a lot of these cases are actually Delta. So this actually shows you the Delta and the vaccination protection. So the fully vaccinated, you can see for yourself, small numbers, partially vaccinated 2.4%, and those who are completely unvaccinated 6%, those who need oxygen or in intensive care or who have perished. So you can see the numbers here speak for themselves. And these are our death and active cases in the ICU. You can see for yourself, there are 40 that require oxygen, 8 in intensive care, 4 have died in the last month. And our moving average cases, our local cases by vaccination status and age breakdown, and so on. Many graphs. These are the imported cases that are coming into the country. They're very few. There are only 2 or 3 coming in every day because there are a lot of border restrictions. We have 122 active clusters. So Delta is pretty hard to control. But we hope that with our public health measures that we'll be able to control it. Now, these are all the clusters you can see. They're just small numbers, but the fishery port is the biggest one, 1,127 cases. This is a fishery port where all the fishing boats come in and offload their catch into Singapore. The casino, I'm sorry, Sammy's Curry restaurant is a big cluster. And it's quite a famous curry place. And of course, the KTV lounges, where the men go to be entertained by hostesses in very opaque rooms and very close circumstances. And some small outbreaks in our dormitories. And these are all the clusters in Singapore. Now, another group, can you see this graph? Can you all see this study that I've put up?
No, we still see the old slides.
Okay, so I'll unshare and share again.
Not on the graph.
Yeah. Let me just unshare and share again. Just give me a minute.
So meanwhile, you do that, Chong, is there a lockdown in Singapore?
Yes, the lockdown as of yesterday, we've announced a partial lifting of the lockdown. So we're allowing restaurants to start dining in again. And there's a clear distinction between vaccinated and those who are not. So for example, if you're vaccinated, you're allowed to dine up to 5 persons in a restaurant. If you're not vaccinated, you're only allowed 2 persons. So they're trying to discriminate between the vaccinated and the non-vaccinated in order to push the vaccination program. Ultimately, the playbook has been border restrictions, social restrictions, and these two have served well in the last year. But we have to change the playbook now because of Delta, and we have to move towards vaccination and public health measures. For example, in Singapore, we have the Trace Together app, right? It's mandatory that everybody uses this app, and it tracks exactly where you are and who you come into contact with either with the tokens or with a phone. So you either carry a token or you carry a phone. The elderly usually carries a token. And from the Trace Together, and that's why we've been able to identify the clusters as they emerge and quarantine them effectively. There are 10,000 people in quarantine right now. So that's how our ring fencing. So we are moving from border restrictions and social restrictions towards vaccination and public health measures. And I think this is the way to go. Some countries have continued to use border restrictions and continue to use social restrictions with a lot of challenges.
Yes.
I think we have to shift. We have to do this quantum shift
In fact, one of my questions, which I think you've already answered, part of it is that, if you talk about Malaysia, Singapore, Thailand, Cambodia, Vietnam, probably Philippines, Brunei, and Indonesia. Among all them, like I think Singapore is the only place which has been controlled in terms of the COVID infection, and rest all the places have extreme things. So I think it's a pretty much good case study for a controlling of the COVID. And best of luck, and I would say congratulations for that. But my best wishes also. But this is something which is very. I was looking at the graph, and I think it's a pretty controlled measures from your end.
Yeah.
No, I just have a question, Saurabh. Sorry. Dr. Chong, you were saying about social measures. For example, now in a dining in, if you have been vaccinated, 5 and non-vaccinated 2.
Yeah.
But they will be in the same premise, right?
Okay.
So even they are same premise,
Yeah.
aren't they going to be a risk to even those who are vaccinated?
So you see, like I've said, what you're doing is, for example, hawker centers, our food courts and hawker centers, which are in the heartlands, we still allow 2 persons to dine, regardless of whether they're vaccinated or non-vaccinated. But restaurants, we allow 5 if it's also to help the restaurants because the F&B are all dying. So it's also to help them. So they have tables of 5 if all are vaccinated. They just have to show their Trace Together app that they've been vaccinated and they can all dine. 5 in a group. Dining has been identified as a high-risk activity because you take your mask off and you talk to each other.
Yes.
So it's a high-risk activity. In the restaurants, you have asked a very good question. The tables are all spaced more than 1 to 2 meters apart. So they're all spaced apart. So there's a requirement. So a lot of the restaurants and F&B outlets in Singapore have actually halved their capacity. They have to put distance between tables. So that's to answer your question. But again, I think social restrictions, we've reached 80%, almost 80% vaccination. So social restrictions and border closures are going to be lifted. So as of yesterday or as of today, we are allowed 8 countries. I can't remember the number of countries, but we allow 8 countries where if you're returning from these 8 countries, you can serve your quarantine at home for 7 days, provided you're vaccinated. So we are lifting, you can see where our strategy is. We are lifting border, we are lifting social restrictions to some extent gently, watching the ICU figures, because we only have 1,000 ICU beds. If 2,000 elderly become very ill and half of them enter ICU, we are finished. The 40 who perished in Singapore, unfortunately, stayed 1 month in ICU before they perished. So you can imagine that if 1,000 elderly enter ICU, they will choke the ICU for 1 month. These are our local statistics. So we are still watching the impact on our ICU capacity, but so far you saw only 8 in ICU. So we are now opening up gradually, and we have no choice basically because we are a city-state. We don't have a hinterland. Unlike, for example, a country like China or a continent like Australia, you can seal off from the rest of the world. We have no hinterland, and if we don't open up, we will hemorrhage to death economically.
Yeah.
So that is what we're doing right now. These are the shift of what our strategy is right now. You can see it as I explained it to you.
Thank you.
Dr. Chong.
Yes.
I have actually specific question to you actually because we can just justify some of the observations actually from the world now regarding Delta variant. We can see there actually because we know there is a fleeting contact. The term fleeting contact in case of Delta variant, which were not present. Do you hear me?
There's a what? There's
Hello?
a what on the Delta there's something I didn't catch that.
There is a fleeting contact. Fleeting contact means
fleeting contact.
Means previously we are knowing that it's a 15 minutes contact is necessary without PPE. But now in case of Delta variant, there is a term fleeting contact. So that if you think that you are allowing the people, which Dr. Ravi mentioned, that you are allowing the people in the restaurant, both the vaccinated and non-vaccinated together to dine together. But there is a distance, no doubt. But there is a term fleeting contact. Do you see anything like that, or do you expect like that? Number one. Number two, second question is actually, what about the healthcare professionals or healthcare personnels, especially the doctors, in terms of the infection and the death? Is there any information for you?
Fortunately, Dr. Chowdhury, we have not had any healthcare worker deaths in Singapore. Fortunately, nobody, as far as I know, no healthcare worker was in ICU, and we were the earliest to be vaccinated. I received my vaccination in January this year, Pfizer vaccination, so we were the first to be vaccinated. To answer your question about contact is very interesting because we have very, very powerful contact tracing due to the fact that we're carrying phone apps or tokens. So I think the cutoff in Singapore now is a contact of more than 20 minutes. 20 minutes, right? Okay. So if you've been in contact with somebody with 20 minutes, they'll quarantine you.
Oh.
They'll definitely quarantine you.
Without PPE, without mask, like that? Without mask?
Even, for example, what has happened is a patient comes into the clinic, sits next to a COVID patient. Of course, they don't know, right? And then if that contact is for a certain period of time, like 20 minutes, because they wait in the waiting room, right? If it's above 20 minutes, they will quarantine the fella.
Oh.
But if it's less than 20 minutes, what they'll do is they will advise you to do ART. Anyway, you're going to do ART and PCR. But they'll advise you to stay at home, not go out. The doctor will write you medical leave. You stay at home for a while, do ART, etc. Observe. If you have symptoms, go back to see the doctor and get a swab. Okay, so they are using about 20 minutes as a cutoff. All right, it's not a rocket science, I must tell you, because they will ask you questions and they'll judge and they'll gauge. So it's anywhere between 20 to 30 minutes. It's not rocket science, I must tell you. There's a bit of voodoo in it. Okay, but there's discretion and voodoo. But you can safely say about 20 minutes is what we're using. And the 1 meter distancing that we use in Singapore, advised, actually came from SARS. Because in Singapore, our hospital bed is about 1.1 meter apart, is standard. And from SARS, we realized that there were patients next to each other who didn't catch SARS from each other, right? Because of the 1 meter distance. But the person that came to visit them and stood in the middle got SARS. Okay, so 1 meter actually comes from SARS. All right, our 1 meter advice. That one's not voodoo. That one is experience.
That's a good analysis, I would say.
Yeah, I hope I've answered your question.
Oh, that's a very good point you brought up about the SARS and the bed and all. Excellent. Yeah.
1.1 meter is the distance between the hospital.
In fact, Dr. KK, when we started off this, and this is good for Malaysia. So when we say, even if you maintain a distance of 1 meter, you should still stand, next to each other rather than face to face.
Yeah, I know.
Yeah. So this is what the observation was, and I think that worked out. So a lot of people, suddenly started, okay, come side to me, and then we talk, and then we are facing the wall and we are talking to each other.
Yeah. I remember he also said, if you are from the back, if you talk, it's better rather than from the front.
So that's why he said that the airlines may not catch an infection if you're not facing to each other, because the person behind you is behind. Yeah.
And I think I've told you about the airline air exchange, right? Modern aircraft, the air exchange is higher than isolation rooms and operating theaters. Yes.
Oh, okay.
Yeah,
that's good.
Yes, Dr. Bukhari.
Do you think this is the continuation of previous pandemic, or this is new pandemic?
Oh, okay. That's a very good question. So from our phylogenetic studies of the Delta in Singapore, the Delta in Singapore did not come from India. It came from Indonesia. And I wanted to show you the paper. Later, I'll post the paper up there. It's our local NCID paper, our National Center for Infectious Disease. And it shows definitely that the Delta is more powerful in terms of compared to wild type, alpha, beta. Okay, it's definitely the oxygen is higher, the ICU is higher, the pneumonia is higher. So the Delta that we have is a variant from Indonesia.
From Indonesia.
And we think it probably came through the fishing boats from the fishery port.
Ah, yes.
Yeah. We
Yes.
think
So
it's from there.
probably Malaysia is also under that category.
Yeah. I'll post the
Yes.
paper up. It's a preprint, and it was quoted. That paper was quoted by CDC in the United States.
Mhm.
Yeah. So
Yeah. Yeah. Thank you.
So excellent. I think so. We covered pretty much Malaysia and Singapore, and I think it's a very useful data for everyone. So we move forward, and let's move forward, Dr. Chong. Let's move forward to other.
Dr. Pillai, you want to update us about what's happening in India?
Yeah, thank you. It was very informative, your briefing about what you are doing in Singapore. That can be a model for other states to follow, but it could be difficult when you look at the number of the population and all. But still, yeah, the distance, the time you spend with 20 minutes and 1 meter away, beds and all, it's good. India, of course, still going through the second wave, plateauing definitely is happening. From 4 lakhs per day, now it is almost 34,000 per day.
Oh, that's very good.
Yeah, and interestingly, the almost 80% of the infection is from one state, my own state, Kerala, where we have 23,000 cases per day. And the fact regarding Kerala is very intriguing because Kerala is, of course, most educated state. Literacy in Kerala is almost 99%. And the lockdown has been very strictly followed. Masking, again, is people's awareness about all these things are very high in Kerala. So what is happening is, have we been more strict with our lockdown and preventive measures? It may be a wrong thing to post, but then because of that, the zero positivity in Kerala is very less, 16 to 20%. The reason assigned is that we have been very strict in the lockdown and COVID preventive measures. And immunization, again, we are now doing well. Kerala state, 40% of the population above 18 years, eligible population has been at least immunized once. All India level is that single shot, at least 40% has received, both about 14 or 16% has received. But we have sort of immunized 42 crores of people. And then the population is 130 crores. So that is the problem that we face. At present, we are immunizing at a rate of 3 billion. Whereas we should have been doing it for 6 million people per day, so that by year end, at least 60% of the population will be immunized. Because of the variants, even for herd immunity, the normal public health dictum is if 60% of the population is immunized or they have a herd immunity, then infection can be controlled. But with this variant and all, even this dictum has changed, and our public health experts say that 84% of the population, if they are immunized only, you can have a herd immunity. So we are trying to do that. Lockdown varies from state to state depending upon the incidents, but then our economy is picking up. Last year we had done better in the economic sphere. There has been 40% increase in the export as far as India is concerned. So slowly we are opening up and trying to live with COVID. The variants is the major problem. Alpha, beta, gamma and all now almost negligible or not present. But then Delta variant, particularly AY1 and 3, are the major challenges. And here, these variants, the problem is that the transmissibility is very high. If a member in the family gets infection, then it spreads on to every member of the family. So the home isolation concept is not working now. So the government is arranging first level treatment centers where even the category 1, asymptomatic or mildly symptomatic COVID positive patients are persons are being managed. But then our admissions are manageable level. There is no overcrowding the hospitals. ICU beds are available, oxygen is available. So those areas we are fairly comfortable. And if you look at many states, the number is very, very less, 600 or 1,000, that range, except of course Kerala, which definitely is a case which has to be much more studied. How this is happening in Kerala, which has been following all the norms, and even the over restrictions, whether that has caused protected the people from even slightest exposure, so that the antibody levels are remaining low. So even Kerala, in spite of the increase in number, Kerala is opening up. Restrictions are less now. Shops are open every day except Sunday, and depending upon the square feet available in the shop, per person 12 square feet area is allotted. To that extent, people can go into the shop. Eating definitely is not allowed in the hotels or restaurants, but takeaway is allowed, and home delivery is definitely practiced. Theaters are not open. Then gym and rest of the sports activities are definitely restricted. So that sort of restrictions, best public transport is now open. Only thing is alternate seat usage. So that way, gradual relaxation and living with COVID definitely is coming in. As Chong has already said, if you are immunized, then much more relaxation and permission is given to them. For funeral and all, still 20% can attend. Marriage, again, 20 to 50% can attend. So that sort of relaxations are definitely happening. And variant definitely is the challenge, Delta variant. How far our immunization protects, a final study report has not come. But then these variants, transmissibility is definitely very high, and they directly infect the lungs, so that the time gap between clinical manifestation and pneumonia and admission for ICU, the time gap has come down. They crash faster, and even mortality is slightly more than it used to be. So that is the situation in India, and immunization definitely is going at a fast rate, and hopefully the second wave may plateau down to the desired level. Thank you.
Dr. Pillai, you were just mentioning about Kerala. Actually, at the beginning, Kerala government was rather admired by throughout the world, I can say, for their control measures and others. Now they're suffering, and you are saying that their level of education is very high actually, and the number of educated people are high, actually more than 95% of what you are telling. So what do you think what is the reason behind it, that why Kerala is having the more infections now in India?
It could be, but then definitely what the reason has not been worked out. One reason, obviously, sensible reason, is that the Delta variant, AY1 and 3, is much more prevalent in Kerala. Second, of course, the people compliance to COVID appropriate behavior has been excellent. So much so their exposure even to minor subclinical infection has been almost nil or negligible, so that seropositivity is reflected in that. Antibody, hardly 43% of people only have antibodies, both due to vaccination and otherwise. And over sort of strict lockdown and people's behavior, overzealous following up of COVID appropriate behavior may be reason. Plus, of course, the major reason can only be the Delta variant, particularly AY1 and 3.
Yeah, I think we can invite Dr. Shashank also to cover up the Indian part of it. He can cover up the Dr. Shashank, do you want to add anything on it?
Yeah. So I think I agree with Dr. Marthan Pillai. Dr. Jamal, what Dr. Pillai says that there are 3 reasons for the Kerala thing. Number one, because Kerala did better management, the exposure was less. Only 42% was the exposure. So obviously there is a larger vulnerable population in Kerala, which is susceptible. And because of which they are now having a small spike. First thing. Second thing is that Kerala, there is a ABCD model. And the government of India has told them to follow TTT model, which is treat, test and track model. And in that ABCD model, everything is going perfect. The only challenge is when there is home isolation in Kerala, sometimes people are not perfect. And that is where there have been challenges in various districts of Kerala. So now the Kerala government is actively looking into it and their health minister is actively looking into it. Also, the number of cases are quite, they always remember the Kerala pattern is different from rest of India pattern. Kerala always gets the wave much earlier than the rest of India. So whatever is the Indian wave, India is a large country. It is like a continent. So there will be some degree of heterogeneity which will be established. And after Kerala comes Maharashtra. Maharashtra usually first Kerala, it is like monsoon. Monsoon hits Kerala first, then it comes to Maharashtra, then it goes to rest of India. Similarly, this is what can happen. The delta is clearly there. Delta plus has not been observed in Kerala, Dr. Pillai, because I'm a part of that genomic group of government of Maharashtra, government of Kerala with the IGIP. So there is no delta plus, but there is delta, and delta is more transmissible. So that is clearly there. The rest of India, if you see the numbers, which I have put it out on the chat box also, the numbers are very clear cut. That after Kerala, there are 5,859 cases as of today morning in the state of Maharashtra. And Kerala has 19,480 cases. And rest of the states like Tamil Nadu have around 2,000. Karnataka has started picking up at 1,800 and 454. So these are neighboring states. But if you see the graph, and sort of, I don't know whether we can share a slide here. If you can allow me.
Yes, you can share the slide.
We just see. This is the India picture. Is the slide shared?
Yes.
So if you see the India picture, everything you look at only this graph here, it's all in the green going up. And if you see Goa is only 133, Gujarat, Haryana, there is no wave there. Himachal Pradesh, there is a clear rise which is happening. Jammu Kashmir, there is some rise which is happening. Karnataka is quite high. Kerala is where it is. Ladakh, there is nothing. Lakshadweep, there is nothing. Madhya Pradesh, there is nothing. Again, Maharashtra has 5,859, which was 10,000 last week. Then Manipur is clearly up. Meghalaya is up. It is northeast. Then Mizoram is up. Then Nagaland, it is not there. Odisha is again going up. Puducherry is not there. Punjab is not there. Rajasthan is not there. Sikkim is going up again. Tamil Nadu is high. Telangana is started to go up. Tripura, as expected, is high. Then, of course, you can see in the state of Uttar Pradesh is only 79. West Bengal is still high. So in India, we are still reporting around 40,000 cases. And there are still around 617 deaths. This is as of today at 8 o'clock in the morning. The only main 2 states which are of concern, one is Kerala, second is Maharashtra, then is Tamil Nadu and Karnataka, and then is Northeast India. This is where the pandemic is. But clearly, because these are less exposed areas, also in Maharashtra, because of the tight lockdown, there has been less exposure like Kerala. Because of the less exposure of Kerala and less exposure in Maharashtra, there is a more vulnerable population. But I think that things are under control. Hospital beds are empty in Maharashtra, just like Kerala. Serious cases are less. Mortality is still there in a small group of vulnerable population. But overall, if you ask me, the situation is much better under control. And we are still a month and a half away from the third wave. And in Maharashtra also, like Kerala, we have opened up everything. We have opened up the shops, establishments, malls, restaurants after 4 o'clock are not yet open. Also, trains in Mumbai are not yet open. But in the next couple of weeks, even they will be open. So that is where we are. And vaccination is now progressing faster and quicker. We will get more vaccines approved. I'm told Johnson & Johnson has also got their single dose vaccine approved in India now. We will have Zydus 3-dose vaccine also approved. So next week we'll have 2 more vaccines approved. And we hope that next week also the WHO will approve the Covaxin like Covishield. So that also will make traveling easy. So that is as far as India is concerned.
Thank you, Dr. Shashank. Dr. Chaudhary, you want to update us on what's happening in Bangladesh?
Yeah, thank you so much, John. Good morning, everybody. In Bangladesh, actually, you have more than 1.3 million now cases actually so far registered, and the number of deaths is near about 22,000. And per million cases, actually, it is only 8,020, and number of deaths per million is 133. So actually, I told you before also, it's outside, mostly outside the capital city, and mostly it was in the border area. Now it has spread actually throughout the country, more than the capital city actually. So regarding the vaccination, actually we are vaccinated first dose, it's 10 million near about, and 5 million double doses taken. And we are on this two vaccines are on trial actually here, clinical trial. Both are Chinese vaccines. One has already got the nod, and the other one is going to get it. Actually, tomorrow there will be a meeting in Bangladesh Medical Research Council. That is an mRNA vaccine actually that is developed by Chinese company. It is some sort of RNA company like that. So anyhow, STEMI RNA. It's STEMI RNA. So actually, this is the fourth mRNA vaccine coming out in the world. They're claiming. We are getting the nod from the authority. Tomorrow there is a meeting. I am also a member of that committee. So probably it will get the nod. And regarding the restrictions, actually here up to the 10th of this month, there is a complete lockdown. Of course, it's not followed too strictly. A bit better than the previous days. So after 10th, there will be restrictions, but there will be no lockdown more. So the daily cases is now near about 12,000. And in the last week, actually, you can say average, there is 12,000 to 13,000 cases up there. So the number of deaths actually per day, it's more than 200, near about 250 like that. And it may increase to some extent, of course, after some days also. But I think this is the situation in Bangladesh. We are just struggling actually here. Thank you so much.
Dr. Bukhari, you want to update us on what's happening over there?
I think Professor Salma is there, president of PMA. I think I will invite Professor Salma.
Oh, is she around? I didn't see her.
I don't think she is here.
I don't think she's here, yeah. I don't see Prof. Ashraf. Is Prof. Ashraf around?
In fact, I don't see anyone apart from you in the Pakistan side.
Okay.
Yeah.
Thank you so much. The current position in the Pakistan is that we have vaccinated around about 35.3 million doses, and daily we are giving the dose 1.1 million. I hope this is satisfactory. The single dose we have given 28 million, and the two doses we have injected around about 7.2 million. There are 4 to 5 vaccinations we are giving in Pakistan. 2 of them are the Chinese Sinopharm, Sinovac, and one is the AstraZeneca, and the other 2 are the Pfizer and the Moderna. The same is the daily cases in Pakistan rising like in the other world. We are also in the grip of the 4th wave. But I think it is not the wave, it is the second pandemic, because our 24-hour last 24 hours cases were 4,720, while the death is also slowly rising. Yesterday, the death was 65, and today the death is 95. So the death is also going up slowly and slowly. Our active cases are also rising in the Pakistan, and the situation in other provinces in Karachi, and in one of the province we have lockdown, while in other areas the situation is not bad. So that is why because like Pakistan have 220 million people. That is why same it is heterogeneous in different area. Some area are improving while some area are the going up. Regarding the variants, we have all variants, but around about 95% we are facing the Delta variants. In a small study in the one province, 85% people are infecting who are not vaccinated. That is a good thing. The other good thing is that the people who are vaccinated and there is breakthrough, they are not facing in the serious infection. They are not going in 4th and 5th category. Few of them, around about 15% of them are facing the serious infection, but they with oxygen. The government has recommended the booster dose to the doctors, to the nurses, to the paramedical staffs, and to the other healthcare workers for the hospital. That was the Pakistan. Thank you so much. If you have any question, you are welcome, sir.
Thank you, Dr. Bukhari. If no questions, I'd like to ask Marie to update us on what's happening in Japan. I've been watching the Olympics every day.
Thank you very much. Thank you very much. We are now experiencing the fifth wave. In Tokyo, 90% of the who is tested positive is Delta variant. So luckily, the people who is 65 and older has get vaccinated. About 80%, they finished the second dose. So we experienced the death of the who is older, high risk of the death is now dramatically decreasing. But unfortunately, Delta variant affects younger generation, and the younger generation gets severe too. During the one from the first and fourth wave, we didn't experience much death under 65, but now in the ICU, mainly 30 to 50s. So and so that means we have about 1,000 people in the ICU, but it is pretty hard for them to treat them because they are very young. And another thing, in the Olympic Village, we are testing every day PCR tests for the athlete. So there is about 10,000 athletes in Japan right now. And during this period, about 300 to 400 people has been tested positive for PCR. But so it seems like very good control in the Olympic Village, but it's kind of everybody thinking about it's gonna be all right to go out or dine. So even though we are in the mild lockdown for the fourth times, but younger generation is kind of fed up with stay home and going out. That's why we are now experiencing the fifth wave, and especially the 20s has been tested positive.
Yes.
Thank you.
I have a question. I have one question on this. So if you see in the graph, I see the number of cases are going high in Japan, but the number of cases in the death has tremendously fallen.
Yes.
In terms of the...
I think this is why it's good question. Thank you. I'm pretty much worried about that because the number of the people who is intubated is dramatically increasing right now. Before that, about 100 people are intubated, but now 1,000. So we are now prepared for the people who get severe. And we cannot keep them in ICU or hospital. We have to take care of the patient who is tested positive at home. So sometimes it's pretty hard to use the oxygen and of course, everybody knows that sometimes the symptoms get worse dramatically. So I hope it's not the case, but we are now in a couple of days, the number of deaths will be increased.
Dr. Mari, Dr. Mari, I have a question to you actually.
Yes.
That I have seen in Japan, actually, it's more than 10,000 some days back. I have seen the per day cases. And I have seen the people are enjoying the Olympic in a crowd. That's like they are not in the stadium, but they are somehow in some sort of hall, they are gathering and watching TV. And so government is allowing it. And they're worried, but why you're allowing, the government is allowing that sort of gatherings actually when it is much increasing?
Officially, the government inhibit the public viewing. So government asked the people to see the Olympic Games at home.
Yeah.
Officially, but you know that the younger generation is not obey what the government says. So they are organizing a private party and are watching the TV, I believe.
I believe it says that the Olympics will come. Olympics will not come again, but the COVID can come again. So let's enjoy the Olympics.
Marie, actually, I watched an interview with the IOC infectious disease advisor, and he's talking about how they control the protocols to control COVID in the village. It was quite impressive. I mean, he was discussing all the control measures for the athletes. Quite impressive actually. What you guys have done together with the IOC people. Excellent.
Thank you.
Dr. Mary, the 400 or 300 positive athletes you isolated, what about their contact? Are they also tested, or what is the situation?
Every athlete has to PCR test every day, even though close contact or not. So, so we are not doing the close contact, the test, but every day they have to take a test.
Yeah.
But anyhow, it's a risky game actually,
The protocols for the Olympics athletes are quite rigorous, and there are a lot of protocols for what if it's positive, and then whether you can train and so on. But what was interesting was the observation made is that most athletes on the field of play, while during the play, the data shows that they hardly get COVID. It's usually after the play when they are mixing together, then the risk of transmission increases.
But Dr. Chong, actually, the Dr. Akhtar Hussain has raised a good question actually here. If you are not following the contacts and you are allowing them to mix again with others, that creates actually more cases actually.
Yeah.
So it is a bit, I think, compromised to some extent. Even Dr. Murray is telling that every day is just they are checking it's okay, they're testing everything. But the thing is that you do not know actually who is actually already spreading. He's already spreading. You do not know. He may be positive, but he's already spreading 2 days before. From today before.
Actually,
so that is the thing.
Yeah, actually, I will send you a link of the interview with the IOC person, and he describes the protocols quite well. So how they manage to reduce the infectivity among the athletes. They have a lot of protocols. I think single rooms and so on, and then you have to leave the village when your event is over. You have to leave the village, or you come into the village only when your event is about to start. And they have a lot of protocols. So I will send you the link later on for that interview. Quite interesting. Now, let me just ask Angelique and Dr. Hussein what's happening in South Africa.
Good morning to everyone there and here on this meeting. I would briefly give a bit of background, but I would like Dr. Atkar to give yesterday's stats as well as our lockdown, and I will concentrate more on the rest. As you all know, we now have, or maybe not know, we now have our new Minister of Health that he was appointed on Thursday night, is Dr. Joe Patla. He was the Deputy Minister, also a medical doctor with vast experience in the private and the public sector. And then we had a new Deputy Minister, Dr. Dlomo, also a medical practitioner with vast experience in public health. Coming from KwaZulu-Natal, Dr. Atkar will know him very well. So we have on Thursday night, we have surpassed the 8 million vaccination mark. Not that it is a huge achievement, because we are busy so long now with vaccinations and we still struggling with that. We have currently over 10 million vaccines in storage, and another 20 million is expected by the end of August. Something interesting, because we have struggled to get Johnson & Johnson and Pfizer's stock into the country. We looked at 1 or 2 more vaccines just as a backup, and we have recommended that AstraZeneca will be brought back, and Sinovac. So Sinovac, there's still data outstanding on the Sinovac, especially in terms of HIV patients. But our third preference would be AstraZeneca, fourth will be Sinovac. So again, the healthcare workers has been vaccinated with Johnson & Johnson since February, and Johnson & Johnson protection is between 91 and 96% effective against death, and 65 to 66% protection against hospitalization. We have seen breakthrough infections now coming through. 96% was mild, 3 moderate, severe was less than 0.5%, and death also less than 0.5%. Johnson & Johnson is effective against both the Beta and Delta variant. Protection against hospitalization in terms of our Beta variant is 67% and Delta 71%. Again, quite safe, doesn't have we don't see a lot of side effects, it's only mild side effects. So here is something that I think we need to discuss on this, maybe in the next meeting or so, is the effect, the vaccine's durability. So we have seen that about on the Sisonke project, the J&J, that 65% had 90 to 120 days durability, and global results also show that protection after 8 months. We are now starting to think about boosters, because some of the healthcare workers are now asking. So there will be guidance now on booster from Johnson & Johnson. But this brings me back to the question as well, what happened in, I think that study was released last week in America, where even though they had their vaccines, it seems to be that 70% of vaccinated people can still spread and can still get infected. So that, and the reason why I bring this up is this plays into the field of the anti-vaxxers. So we need to maybe discuss this a bit. Maybe Monica or anyone else who's got a lot of information on that can help us out. Just want to say again, on our vaccination, our government wants 300,000 people vaccinated per day to reach about 34 million by December. But currently they're struggling. It's about, the average this week was around about between 180, 190,000 people vaccinated. the total individuals vaccinated is about 16% of adult people, and that's above the age of 18 years and older, although we haven't really started to do the 18 years between 18 and 35. That will start next month. So the stats is not always really displaying what we are seeing. Just to come back to the hospital admissions and what we are seeing in our hospitals. Our current hospital numbers, people admitted, is 15,300 more or less. In ICU, we've got 2,330. And then ventilated patients, we've got 1,270. Our hospitals still very much under pressure. And in South Africa, luckily, we as family practitioners can treat COVID-19. So we have established that the most important thing with COVID-19 is that you need to see the patient within 7 days after they've been tested or after they've been infected. If you can see them, start with your colchicine and initiate your cortisone at the right time, you actually bring down the hospitalized cases and you bring down death. We have also treated very successfully at home people with blood gases of oxygen levels around about 56 to 60% successfully with oxygen at home by using your blood thinners, your cortisone, your colchicine, and your oxygen saturation monitoring of the patients. Keep and then good communication with these patients successfully at home. And so I'm feeling very sorry for my colleagues in Malaysia, because you can do it at home. There's no reason why you need to send everyone to a hospital. It is putting unnecessary pressure onto those clinics and hospitals. And that's briefly in a nutshell from my side. One other question that I also would like to throw into this group is our Minister of Education. South Africa, over the past few years, we kept on telling them that the classrooms are too big. There are too many, the pupils in the classroom are too many. You can't have those big classrooms and teaching these children. They never did anything. Now she wants our schools to reduce the distance to half a meter between pupils in primary school and in secondary school, and providing that they need to also open up the windows and the doors for good ventilation. I'm a bit hesitant about that. I don't think half a meter between school pupils, because that means then she can still have all those lot of children, 50, 49, 50 per classroom, which I think it's not right. Just want to get an opinion on that. Thank you so much. I'll ask Atkar to just give the other stats.
Dr. Hussain?
Thank you, Chair. Thank you, Angelique. I think you have covered almost most of the issues of South African and how we are progressing. We are not different from any other country we have here listening now, from Bangladesh and other country. Our situation in Cape Town and Kerala almost similar. Cape Town is almost in a red zone nowadays. Numbers are just going high. And other issue, we have total number 2.5 million cases so far, and recovery is 2.2 million, 74,000 deaths till now. And last 24 hours, we had 13,523 cases, and death last 24 hours, 479 cases. We are still in third wave. As Angelique said, vaccine, we're using J&J and Pfizer. other issue, school children. Now we are seeing numbers are increasing in school children. So these are all Delta variant, and household, if one guy is getting in one house, 4 or 5 people getting infected. So we also treating a lot of our patient home-based care and oxygen supply if they need. At the moment, hospital oxygens are available, bed is available, ventilators are available, except Johannesburg, which is going down the number. One of the city had a very bad situation, now is improving. So KwaZulu-Natal, we are also seeing numbers are increasing. So Cape Town and KwaZulu-Natal at the moment is getting high risk. Thank you, Chair.
Thank you, Dr. Hussein. Alvin, do you want to tell us anything about Hong Kong? And then finally,
Yes.
Dr. Russell.
Can you hear me now?
Yes.
Yeah, I think in Hong Kong it's not much different from the past few weeks. And in fact, we have less than one case in the community per week. But we do have a few at the border coming back from other countries, carrying with the Delta variants usually. And in Hong Kong, there are no increase in the ill cases. So most of those confirmed cases that had been back from other countries were all either asymptomatic or very mild, not severe at all. So at present, it's not a stress to the hospital system in Hong Kong, but of course we can't tell if one of those Delta cases in the community is a super spreader, then it could spread very fast. We were very careful now to prevent this scenario to occur. And then the most important thing to do now is to encourage vaccinations. So far, we had vaccinated in about 40% of our population. About 50% of our population has the first dose, and then 40% has completed with 2 doses. So it's still a long way to go because our experts had warned us 70% is no more the threshold for herd immunity with the domination of the Delta variant. So they would expect the threshold for a meaningful herd immunity to be 80% or more. So that is even a bigger challenge, given that some citizens in Hong Kong are still very much hesitant, or even they are anti-vax people who determined not to get vaccination. So now the government had moved out to implement a mandatory vaccination program for all the civil servants, for all those people who are teachers, even those doctors who are working for the government in the hospital authority or the Department of Health, and then all those school teachers and carers for elderlies in the old age homes. So these have to be vaccinated mandatorily. So of course, there are voices of opposition, but then because of the very stringent rules now passed in Hong Kong with the national security law, many, KOLs or the opposition leaders are silent now. So the government will push for the mandatory vaccination for all these people and would encourage the elderly to have the vaccinations, because the elderly population let me see, only less than 10% of the people over the age of 70 or 80 had got vaccinated. It's really a low percentage for those old-aged people. So I mean, the government is now very stringent in the measures to encourage the vaccinations, at least in the civil servants and of those people working in the front line to care for people. And for the elderly and for the teenagers, the government is also setting up the turbo engine to encourage vaccination. So that's the update situation in Hong Kong. Thank you.
Thank you, Alvin. Dr. Russell, do you want to tell us what's happening in Melbourne?
Well, I've just listened to all of you. As you know, Melbourne, Dr. Chong, you're fully aware. We've just gone into another snap lockdown yesterday or day before yesterday. So this is the second day. We had a good go, and suddenly we had a few cases. I think there were 6 or so. It's now today gone to 26. We're taking a lot of action because of this Delta virus, right? And as you know, Sydney is not under control, and that seems to be seeping through for some. This one seems to have, there is the genomic sequencing seems to have come from there. But all the same, Sydney's recorded about 300 odd cases today, a large number. Melbourne had 26, and Queensland, which is coming out, they have 13. So 13 cases, but three of these states and well over half the population of this country is in lockdown at the moment, although they seem to differ in each state. Melbourne is supposed to finish on Thursday, but looking at what's happening, it looks at now the number of cases, and all are limited to 2 clusters, but unfortunately, they have been in the community before they were isolated. So we expect that it will probably, at least in Victoria, Melbourne, we expect it will go up a little bit. But otherwise, then the other thing is that they're ramping up the vaccine. So we have now had a significant number of people are getting, all hubs are opened out, number of, and New South Wales is probably to some extent looking at the policy they have taken is probably, it looks like it's gone fairly out of quite large, particularly they haven't used the same tech. They've only locked down certain areas and have different types of restrictions, which seems to not be working. And so today, the Chief Health Officer, Kelly, Paul Kelly, said that they have to have, the trouble is this a federation, and you know, every state runs by like a country. Each one's got its own, and they can't interfere. And so he's advised that circuit breakers needed for New South Wales. So New South Wales is in that trouble, but it seems to affect everyone else. And so all the states are locked, so you can't travel anywhere, and so forth. So that's the situation. The Delta virus is causing this. And of course, the vaccine, as we are rolling out, AstraZeneca and Pfizer are being given larger. They're now advising not to follow because of New South Wales having the pandemic. They reduced the number of weeks necessary between the 2, first dose and second dose. And so I think they have got a plan to have 80% by December. I hope it works out. Yeah.
Thank you for that.
Okay, and of course, one more thing was that we had another death. We had the 7th death yesterday from the AstraZeneca clotting. So that was 600 and odd different, from the hospitalizations, from the side effects or the reaction to the AstraZeneca vaccine.
Just one question, actually not to Dr. Russell, actually, but I'm to Dr. Chong.
Can we take this question on the offline thing, because I think we are now almost late. We are almost crossed the next session is almost to be started. So I'm sorry. I think we will take this discussions on the group, or we can take it next week. We have a WhatsApp group, so we can ask that question. I would like to interrupt you, and very sorry for that. Thank you everyone for this session, and I think it was a pretty good update from all the countries. Do watch us this session, and most of the countries have given their updates. This was a 70th session, which was from CMAAO. We would close this session now and see you next week again, same time, same week, same day.
Thank you.
Thank you.
Bye.
Thank you.
Yeah.
Thank you.
Yes.